Okay, yes, welcome to our workshop on effective policy communication to advance community health. If you would, please share in the chat your name and pronouns, your organization, where you're joining from, and a topic or issue you'd like to keep in focus as we go through this workshop together. So I'll drop that in the chat. So here we go. Name and pronouns, your organization, where you're joining from, and a topic issue you'd like to keep in focus for the workshop. And this workshop is made possible through a project collaboration between our Prevention Research Center and 4 community health coalitions: Be Healthy QC, Butler County Wellness Council, Healthy BR, and Live Healthy Miami Gardens. This is part of our center's multi-year core research project, which is funded by the CDC. The overall goal is to develop and share strategies that support the use of effective policies and policymaking at the local level to advance community health equity. A couple notes. First, this workshop is being recorded. Second, the recording and slides will be available after the workshop. So you'll have access to them and you'll be able to share with colleagues. And oh yeah, I'm Renee Parks. I'm with the Prevention Research Center. You may have seen me on previous workshops or seen my name or many emails. So here I am. And I just want to note that the principles covered in this workshop are tailored to policy audiences, but please know they apply to any type of communication, to partners, agency leaders, the general public. So yeah. Well, let's start off with talking briefly about our workshop norms. So if you haven't already, please turn off your microphone, go on mute. That doesn't mean we don't want to hear from you. We definitely want to hear from you, and we will pose questions and you'll have the opportunity to unmute. But we just don't want to have that background noise right now. We'd love to see you. You're welcome. But do what is going to best serve you. So if you need to turn off your camera, totally understand. And then feel free to ask questions, share resources in the chat. We will certainly do our best to summarize what we see in the group chat aloud. Okay. And here's our workshop team. Yes, I am joined by some incredible colleagues at the Prevention Research Center who bring a great deal of experience in public health and policy and research. So I'm going to let them introduce themselves and talk a little bit about who they are, starting with Ross. Ross, please enter the space.
Yeah, hi. Hi, everyone. I'm Ross Brownson. Who am I? Most days, I'm the director of the Prevention Research Center and a faculty member at WashU. And I think of relevance to this. Before moving to academia, I worked 8 years in the state health department in Missouri, and about half of that time, basically during the legislative session, was spent working with the governor's office and the legislature, trying to get more support for public health, whether it's through funding or through laws. So I have basically no formal training in policy communication. Everything is sort of learned on the job. So that's just a little background on me, and glad to be with you today. And thanks, Renee, for organizing this great workshop. I'll hand off to Beth.
Hi, everyone. I'm Beth Dodson, and I'm also with the Prevention Research Center. In fact, I realized this week that this is my 20th year with the PRC, which is totally believable if you look at the picture that Renee has on the slide and you look at me. It's been a long time. But I was also thinking my very first project when I started working with the PRC was actually something called Project WOW, and we were working with Poplar Bluff and Doniphan and West Plains. And so I got to interact with people in that area, as well as having spent a lot of time actually down in the Boot Heel growing up, because my grandparents lived in Kennett. So I spent a lot of time down there, and I have a fondness for your part of the world. I know not everyone's on the call is from there, but that may be more interest to you than the fact that I've spent time studying how to communicate with policymakers at the state level and at the local level, and spent a lot of research energy trying to figure out how we can do a better job of this. So this is a fun thing for me to get to talk with you all about today. So thanks, Renee.
Thanks, Beth. And I'll just share a little bit about myself too. So I've been with the PRC, not as long as you, Beth, but coming up on 8 years. So, and in that capacity, managing and supporting some really great community engaged applied prevention research projects. But before joining the PRC, I worked in community health promotion for more than 12 years, and I worked at nonprofit organizations. I worked at a couple of universities and even in a corporate setting. So yes, lots of really great experience. And I definitely lean into the practitioner, the community health practitioner. So glad to be with you. And yeah, we'll keep things rolling. Okay. Want to acknowledge and give credit to the evidence-based public health or EBPH framework and training. This workshop is grounded in the disseminate evidence portion of the EBPH training. And just so we're all on the same page, EBPH is that process of integrating research-based interventions with community preferences to improve the health of our communities, populations. And a while back, 1997, our PRC developed a course on EBPH to train the public health workforce in applying evidence-based decision-making to improve population health and really advance health equity. So we have this wonderful partnership with National Association of Chronic Disease Directors to really make that course possible for many public health practitioners across the US. But glad that we are able to bring some of that to you as part of this workshop. All right, so here's what we want you to take away from the workshop. We want you to be able to define the components of a communication model and apply that model to policy communication. We want you to be able to describe key elements or aspects that are included in a policy brief. And then we want you to gain some experience developing crafting messages. So, all right, I'm going to turn it over to Ross to get us going with our workshop outline and content.
Great. And just to sort of set the stage, and what Renee was saying, this workshop could be someone's whole career in learning about policy communication. It could be a degree, it could be a course. And so we're really just having you dip your toe in the water and trying to do something in a pretty short period of time that we hope will give you, first of all, that will get you excited about some of these concepts and applying them, a few ideas, maybe something you hadn't thought about before, and then some resources and some of that learning through an activity that we'll do a little later. And so my part of this is going to be, I guess it's sort of introducing some of the basics. And as we go through, if you'll sort of think about whatever issue you're interested in, and I know a number of you put that in the chat already, think about how this might apply to your work in your world and something you care about, because when it's something we care about, it always has more meaning. And so if we go to the next slide, this next slide is just a definition. And one thing that's important when Renee said, evidence-based public health, here we don't mean evidence is only research evidence. Evidence could be a story about how someone was affected by, diabetes in a community. It could be qualitative evidence. It could be actual statistical data that's collected through a survey. So remember that evidence comes in many forms. What we're trying to talk about here is this distribution, something that's more active. In other words, not just throwing it out there and seeing what happens, but something that is an active process that takes into account basically how we receive information. And we'll talk a little bit here about audience tailoring because to whom you're communicating probably makes almost as much difference as how you communicate it, because everyone will look at evidence differently. So the next slide takes us through this continuum that I talked about when we meet evidence. So on the right-hand side, this is my experience of something, or this is word of mouth. On the far left-hand side, the things we would think about as more systematic, more rigorous, that's more sort of scientific, and then a lot of things in the middle. It doesn't mean that one thing is better or worse than the other. It just means that evidence comes in a lot of different forms. Of course, when we're making important decisions, we'd like to use some of this evidence on the left-hand side but it might be informed by your professional judgment. It might be informed by data in the marketing world, and it might be informed by word of mouth as well. And at the bottom is this, you've probably heard the quote that beauty is in the eye of the beholder. And really evidence is the same way. How you communicate evidence to a local mayor who might have no background in health is going to look different than it would be to communicate to one of your coworkers or to your grandmother or to the leader of your coalition. So there could be a whole range of different audiences, and that implies the difference. All right, so if we go to the next slide, and we're going to ask you to think about chat. When you think about the idea of communicating evidence, and think of evidence in whatever form makes sense for you, what are some of the reasons for communicating about evidence? And let's just try to get a few things in the chat. And no right or wrong answers here. What are some of the reasons? Great, thanks, Nicole. The first idea is always the hardest. Credibility, encourage investment of resources. If you even take that further, it might be the idea of return on investment. Credibility, show benchmark. So Gina's got sort of a data-based idea, reason. Okay, let's see if we get a couple more. Yeah, data. So getting data out in some form or another. And data, often people will use synonymously with evidence, so that's good. Any others? Okay, well, that's good. So let's go on, Renee. So if you think about communication to do something, communication experts often think of three sort of overlapping domains. One is to increase the reach of something. In other words, to reach someone, new audience who may not know that opioid addiction is a major public health problem in rural areas. Now, some may know that, but some may not. You might talk about the importance of motivating people to change behavior or find information, and then the ability to be able to use the evidence and apply the evidence. And the ideas you put in the chat for the reasons all are sort of, I would say they're sort of the fine-grained parts of those, at least those three pillars that we think about as reasons. And we've got a nice little graphic for you in the next slide. So there's a quote by the philosopher George Berkeley, and it's something about, I think it's if a tree falls in the forest and no one's around to hear it, did it make a sound? And so this is kind of a takeoff on that. So if you're trying to communicate about evidence and no one does anything differently, in other words, nothing changes, does it make any difference? So the idea here, and this is sort of a foundational piece of what we're talking about today, is we really want to do something that's going to make a difference. And so in the next slide, if you think about the idea of making a difference. So some of you remember back at the turn of the century, we had all this talk about, our computers aren't going to work anymore. Well, there was a landmark publication that came out about the top 10 public health achievements of the last century. If we updated that 24 years later, I don't think it would change a whole lot. And I put up 5 of the 10: vaccination, motor vehicle safety, safer workplaces, water fluoridation, and tobacco control. The reason is all 5 of these, as well as all 10 of the top public health achievements, all included policy in some form or another. And so remember that policy probably has the biggest impact on our health and well-being and on equity as anything else. The little visual to the right also reminds us that under the heading, for example, the second one on motor vehicle safety, if we pass seatbelt laws, we might need a communication campaign to help people be aware of the seatbelt law and the benefits of buckling up. And so, and the seatbelt law is a great example because it's really a passive policy. Once it's in place and people get in the habit of doing it, it's very easy to enforce. In fact, enforcement is almost nil, and we have a very high compliance with seatbelt laws. Okay, so next slide. So now I'm going to get into a little bit of the idea of audience segmentation, at least the beginning of that. And I put up here 3 audiences: big P policymakers or legislators. This would be your elected officials. This could be an elective person on a city council. This could be a state legislator. The other are coworkers, other people like you, and then other partners in the community, let's say who don't necessarily have a lot of knowledge or background in health. So if you're communicating with a policymaker, you might want to do something about, like Nicole said, about investment, return on investment. If you're talking to other coworkers, you can probably use a little bit more technical language and you can focus on common goals. Most people working in the health sector, common goals are to make a difference, to improve health, and to decrease disparities or improve equity. And then for partners, it's often a little more heterogeneous. We want to avoid the jargon. We want to show benefits. That could say, my family will be healthier. I'll be able to pay for healthcare for my kids. I'll be able to take my child to the pediatrician, or our community will have better community cohesion. We'll work together better, and we'll prosper sort of as a community. And so remembering that, and we'll get into this a little later, that the audience really does matter in how we develop communication strategies, what they are, what the message is, and how we deliver that, okay? Now we have a little chat again. So if you think about that one, I mentioned the concept of health equity, or if you want to think about that differently, think about decreasing health disparities. What are some of the challenges that you might face in your work if you're trying to communicate specifically about health equity? Let's see what you come up with on that one in the chat. And this is kind of a hard one, so ponder this a little bit. What are some of the challenges related? Okay. Dixie, know and how to put it. Okay, Dixie had one about knowing how to put it into practice. That's great. Great. Other ideas about equity? Gina, good one. Yeah, complexity. Equity is a complicated concept. You know, is that who's being affected? Is a different health condition? How do we communicate that? Even, yeah, good one, Brittany, about equity versus equality. And we could do a whole session on that. Health equity is broad. And I'll add one. You know, now in some settings, the word equity itself is charged. And so, like when I talk to people working in public health in a very red state, I talked to a health officer in Alabama several weeks back, and he said he can't really use the word equity, but he can use the word fairness. He can use the word like leveling the playing field for everyone. So even thinking about that concept itself and then the wording around it, if we can get to the same endpoint with framing the wording a little bit differently, then we need to do that. And we can't always use the endpoint the way the wording we may want to communicate if it's other people who are trained and think like us. So that's a great one. All right. Okay, I think we can go on. You guys are doing a great job in the chat. Thanks for doing that. It makes it a lot more interactive. This is just a reminder, really. And the reminder here, and I'm speaking here about experts meeting like researcher types, like the nerd researchers. They start with long explanations. They write a scientific article. They publish it. They go through all these logical explanations. They put in all these caveats. And then gradually they get down to the point where it might mean something to a community coalition member. Well, what do people want to hear? They want to hear first the point. Give me the bottom line. And then they want to have varying degrees of what's the basis around what got you to that bottom line. So let's think about, especially for those of you who operate a lot more in the academic world, or even someone in a public health agency or non-governmental organization who deals a lot with sort of research-oriented evidence, that we want to kind of reframe it the way people really receive and learn about things. All right, so next I'm going to go through kind of quickly a basic communication model. And believe it or not, this model, we kind of do a new graphic of it, but this model goes back to 1949 to scholars in actually they weren't scholars, I think they were business people, Shannon and Weaver, and they basically came up with what is really kind of basic, 4 common elements of effective communication. And we're going to briefly walk you through each one of these and explain them, but it's the source. It's go to the right-hand side, it's the audience. We talked a bit about audiences already. It's what the message is, and then the channel is the how. And so we're going to break that down a little. And this is held true now for what, 75 years basically, as a model that it keeps getting redone in different ways, but the basic model, believe it or not, is not that different than 75 years ago. So it's a real oldie but goodie. If you go to the next slide. And the next slide is basically the pieces of this. So if you think about those 4 components of the model, I didn't mention the context. Maybe I'll start with the context. That's kind of the surrounding conditions. If you're in a situation where let's say you're in a health department that has a tax mill levy where you've got dedicated funding to work on health disparities, and that funding is going to be consistent. That's a different context than a health department that has to scramble to get funds to do anything, and they're very categorically funded, and the funding kind of comes and goes. So that's a context for a community or an agency. The source is the origin. So that might be a researcher, that might be one of you, it might be a funder. The message is how we're packaging the information. In other words, what is the message we're trying to get out? How do we take something and put it in a form that people understand? The audience is kind of self-explanatory, and we list out 3 or 4 audiences here: partners, policymakers, community members. And then the channel is how we deliver that audience. So the channel might be something we'll talk about today. We write a policy brief, or we create a video, or we do a mass media campaign. So in that case, the channel would be mass media. Okay. And then the next slide is we're going to give you a few examples as I wrap up this first part about applying this model, that sort of Shannon and Weaver kind of simple communication model for policy communication, which is the theme here, obviously, today. All right, next slide. And next slide, this kind of has a lot going on. I sort of said the one on the upper left, policy can really change the world. It can improve inequities. The horizon for policy is often shorter than for other audiences. Policymakers usually want stuff pretty quickly. Often it has to do with an election cycle. They have a strong preference for local data. We have a bit on that later. I'm going to skip to the bottom one on the right first. The ideology of policymakers is important, and how you frame things. We won't spend a lot of time on that today, but that's also important. And then trust in government really matters, and it has been a challenge the last few years. This is from 2021, the data we have here, and it's even lower now. What's important, though, is trust at the local level is drastically different than trust at the national level. So those of you working at the local level, like all of you are, have an advantage than those working at the national level. Right now, I think the trust at the national level of both national government and Congress is down around 20%. So it's gone down even more than this. But trust at the local level, even through COVID, has held up much more. And so that's important to keep in mind. Like we have a saying, all public health is local, and all impact really can be local, because local has a lot more chance to have things happen than we do at national and state levels. All right, so I think we have one more question for you. So now we're shifting. We talked about challenges related to equity. Now think about challenges related to communicating to policymakers. So if you're trying to communicate, and you can think of whatever policymaker makes sense to you, it could be the mayor, it could be city council, it could be your representative to your state legislature, it could even be a US senator if you want, or it could be someone in the middle who's trying to influence the policymaker. Some people call those intermediaries. What are a few challenges on this one? Particular to policy communication. If it's different, I think it might be a little different. Good, Christina, thank you. Time or interest, yes. Yeah, the legislative process. It's like the saying is like watching sausage being made. It's messy. Don't always know what goes in the sausage. Competing priorities. Yep. Yeah, this Katrina hit a really important one. Like in the epidemiologic world, we call that assessing causality. Like if you do something and it improves, can you attribute that to the things you're doing and the impact of the things you're doing? I think that's what you're getting at. And that's a really good one. I like to think about contribution, not attribution. That if there's something that your work is contributing to and it's showing benefits, then take ownership of that and at least take partial credit for it. That's really good. Okay, those are good. That's a really good coverage. Okay, and the next one's going to give you just a little bit from the literature, from a large systematic review, 145 different studies, many topics, a third of the studies. This is kind of a review of reviews. So in other words, a whole bunch of studies that were out there that were reviewed. And the 1/3 in LMIC, that means lower middle income countries. That means other parts of the world. Amazingly, they all hold up pretty well. You hit on some of these. Timeliness, you hit on clarity. And then if you look at the top bullet, lack of access to high quality research. And this is a little bit more oriented as evidence as research, but these come up for other things as well. We'll learn later about the value of local data, and sometimes finding local data at the fingertips is a lot harder than it is for finding state or national data. And we need some new thinking about how to overcome some of these, especially the more localized it gets because of some of the challenges that you talked about earlier. All right, we go on to a few more. So now the source, what do people want to know about the source? They want it to someone they trust, someone they perceived as unbiased or less biased. Let's face it, nobody is totally unbiased. We all have our biases. And then relevant to their constituents for a policymaker. And this next one, I don't totally believe this. The next slide. The next slide looks at perceived reliability or trust. And this is a survey that a colleague at Drexel at the time did, Jonathan Pirtle, and they ranked universities as the most trusting. I think we have social desirability going on there because I don't believe that universities are the most trusted source. I do think that constituents are high. I think other legislators, non-governmental organizations, the NCSL is the National Conference of State Legislatures. That's a non-governmental organization that state officials really do trust. Industry and media was the lowest ranked one by quite a bit, and that probably is pretty accurate. So that's important to keep in mind. Next slide. And then keeping in mind the importance of intermediaries. There are people who are the connectors between, let's say, governmental public health and elected official. And often they have connections. They are people from the local community who are trusted. They can build that trust. Working with them can be really valuable. And some of you, I mean, all of you do this in one way or another already. And that means to find local data that's actionable and help you in advising on the decisions that can be made. Okay, a little bit more on the audience. Okay, remember in the cartoon here, the caption, communicating for something, not just about for someone. In other words, something they want to learn about, not just about something. In the next slide, this little cartoon illustrates it really well. So what do we want to say on the left side and what they're interested in? And it's really the overlap. And what you want to do is try to work about more of what you want to say is the things that are interested in. So the overlap of these circles gets bigger. What do they care about? What are their needs? And where, when, and how they seek that information is really important. And yeah, Katrina, we will get you a copy of the slides for sure. Okay, and then the next slide. Remember that even the term policymaker comes in a lot of different forms. Mostly here we're oriented toward elected officials. But if you're talking to the state health officer in Missouri, Paula Nicholson, she is in a way a policymaker. She's not elected, but she is making resource allocation decisions. So their policymakers come in a lot of different forms, and they come all the way from local, state, national level, and even even sometimes varying jurisdictions around there. You might have a district health officer, for example, that could be multiple counties in the state like we do in Missouri, okay? And then the next slide. This next slide talks about what some of the characteristics of this audience could be that make it important for them. And we sort of talked about these being accountable. Typically, policymakers cover a lot of issues. They don't have deep understanding of many of those, so you have to keep that in mind. They spend less time on each issue than most other audiences, and they want some real-world stories. There's a colleague in Colorado, Ned Kalanch, who's been a leader there in public health for many years, and he used the quote is, "No data without stories and no stories without data." So in other words, marrying together the evidence with the story is often a very valuable way of doing it. Okay, and next slide. This is a new publication that Beth just put out, and when you have the slides, you can click on it if you want to read the whole thing. The thing that's important about this is with local policymakers in the US, what are the things they rated as really important when they are trying to learn about policy, when they're trying to use evidence in their policy making. And you could see there's quite a few things, but local data, the constituent, cost effectiveness, in other words, the financial part of it, scientific effectiveness, the recommendation locally, and then their own personal interest. And so all these are important, and probably if you can hit on several of these at the same time, that's even better. Okay. I think it's time to hand off the proverbial baton to my colleague, Renee.
Thanks, Ross. We've just gone through quite a bit of content. We're going to go through a bit more, but want to give y'all just kind of like a bio break, stretch break. So we're doing okay on time, so we can make this about 5 minutes. So please come back at 1:38, ready to take in some more information, and we'll get ready to do some activities too. All right, so let's talk message. So the aim for most of our communication in promoting community health, and in particular with policymakers, is persuasion. We want to bring attention to, shift, possibly strengthen attitudes towards an issue. And we want to increase motivation to use and apply the evidence that we are talking about. And as we think about messages, I want us to recognize that we and our audiences are not empty vessels. I think we get that, but sometimes I know I am guilty of it. Like, it's just like, oh, I just need to put this information out there without really thinking through, the fact that our audience, and as each one of us, we hold and have values and beliefs and assumptions that shape how we view and understand the world. So as we think about messages, this is how we are communicating a story we want our specific audience to hear. And the way we present information, we can get people to open up and access different ways of thinking, feeling, and acting about those issues. And that's what framing is. That's what we're talking about when we're talking about frames. And with the understanding that people understand and make sense of the world through images and stories. And when we talk about like the public narrative or that story, that really is a story that connects issues and actions to values. And it really has the power to shape and give sense to what's needed to happen, to be done, and what is possible. And it's through framing that we elicit those narratives that we hold. Kind of thinking about culture, what Ross is talking about with that context, excuse me. And just a note about dominant public narratives. Those are the ones that really override other narratives and really have that power to shape what is possible, the most power to shape what is possible. And I think as we think about community and public health and building health equitably in our communities, we need to be mindful of not conjuring up or eliciting those dominant narratives in our messaging and communications. We need to be speaking to other values and narratives that maybe sway us away from that. And I'm thinking of something that like, and you all might be thinking of some when I think of like dominant narratives in our culture in US society. Like we have those stories of bootstraps, individualism, free market solutions, the limited role of government. These are dominant narratives, and we may not want to be calling attention to those pieces because they may be counter to what we're trying to achieve and our goals for advancing conditions to support healthy communities. So we want to be mindful about the frames we use because they're eliciting these narratives. Okay, so I do have the
choices that you make as communicators.
Just going to set this up a little bit more before I jump into it. So this is a talk from Nat Kendall Taylor, who is an anthropologist and CEO of Frameworks Institute. He, in this video, breaks down the science of framing for communications, and we're just going to hit upon just a portion of this video, and hopefully you can hear it.
Indicators matter. Sometimes the little things, the pronouns that you use, the verbs that you choose, sometimes the big things, the values that you use to explain why your issue matters, those things matter. Those things have frequently dramatic impacts on what people are willing to do and how people are willing to act and engage on your issues. And again, I don't want you to take my word for it. I'm going to give you a quick example that shows you that understanding is frame dependent. And this example comes not from the United States, but from the Canadian province of Alberta. And a quick geography lesson, Alberta is one of the tall, skinny ones in the middle of the country. It's kind of all you need to know. It's very cold for this example. And so there's a group of experts and advocates in Alberta who are working to change policy and practice around addiction. They're working to take what we know from science and use it to implement better policies and practices around addiction in this province. And they've been having a great deal of difficulty doing this. A lot of their problem comes from the fact that there's zero support to do anything different when it comes to addiction in this province. And so they came to us and they asked us to conduct some work to figure out how to engage members of the public more productively, to move understanding, and specifically to increase support for a set of evidence-based policies. And so as good framing geeks and dweebs, we do what good framing geeks and dweebs do. We ran an experiment. And in this experiment, we tested 3 different values messages. And so you see the values messages along the horizontal axis of this graph right now. And so some people, so this is a large experiment, 6,000 people, which, believe it or not, is not the entire population of Alberta. It's a representative sample, not an exhaustive sample. Each of these 6,000 people is randomly assigned to one of these messages. So some folks got the value of interdependence, which in this case is the sense that we need to do a better job of dealing with addiction in this province because we're all connected. What influences one of us influences all of us. Other folks got this value of ingenuity, which is an innovation value, that we are a province of problem solvers. You kind of swing your arm when you do this one. There's never been a problem that we haven't been able to solve with some good old Albertan grit and roll up your sleeves problem solvingness. That was my Albertan accent. I don't know if you caught that. That's very important. And other folks, last but not least, got this value of empathy, which is the sense that we need to do a better job of dealing with addiction in this province because people who deal with addiction are people too. They could be our mother, brother, father, sister, neighbor, whomever. And as individuals, we need to show these folks compassion. So what you're going to see on this next click is what I think are 3 beautiful blue bars will appear on this screen. And what those blue bars are going to show you is the extent, the degree to which hearing these different values changes people's support for these evidence-based policies. So can anyone do a good drum roll? Please play along. Thank you, thank you, thank you. So you should see 3 blue bars and notice 2 things. So first of all, 2 of these values, interdependence and ingenuity, make people, to a statistically significant degree, more supportive of these evidence-based policies. That is good news when we run these experiments. And when we get results like that, we stand up, we do a little framing dance. Not going to do it right now, don't worry. We sit back down and we look towards the right-hand side of the screen. The value of empathy is actually depressing people's support for these policies. right? Now, the kicker is that in a subsequent piece of analysis where we looked at all of the field's external facing materials, guess which value we found to be in place over 90% of the time? Empathy. Thank you. Not a rhetorical question. And so what this field has been doing for a very long time is endorsing a value which actually drives support down for the very policies that they're advocating. So this example does two things. It clearly shows you that that understanding is frame dependent and frames matter.
Hopefully that video came across clearly okay. I know that there were some pauses in the actual video, but the audio seemed okay. So the importance of framing. And I wanted to share how there's been some recent messaging and framing research from the Robert Wood Johnson Foundation and Big Cities Health Coalition, specifically on communicating about health equity and public health, and really what is resonating with local legislators and policy influencers. And policy influencers, they defined as news attentive, civically engaged voters. And so among these audiences, the format that worked for them is the need to start by setting up what is at stake and why it matters. We need to help our audience see themselves in the issue by connecting them to a shared value. Then moving into a positive vision. So change is possible. And then grounding in a problem statement that is in place. So talking about place, and depending on our audience, our policymakers, and how we're sussing that out, consider including race and income. And then end with a call to action and unity statement. And yes, this is research from RWJF and BCHC, but there are similar studies and findings from the collaboration that Frameworks did with the Beaumont Foundation, as well as Berkeley Media Studies Group and Race Class Narrative Action. So values really, in the finding, its values work better than examples, statistics, or even facts, because people make decisions based off of their values, then they look for facts to reinforce their values, especially in conversations around issues that are linked to personal identity. So in Big Cities Health Coalition messaging research, there was, and these were kind of the two. Did I skip over? I feel like I skipped over. Yeah, sorry, I skipped over that slide. There was an increase in support and the change in wording. So helping residents to be healthy to a city that makes sure residents have opportunities to be healthy. So this empowerment framing. So they saw this increase among all policy influencers and by almost all demographic groups and those of different backgrounds. The ones that I have up here on this slide are the ones that saw like the biggest jump. So again, empowerment framing and that value of opportunity. I think this also conveys the value in communicating how your community supports opportunities for health as well. And then these were the two messages that were the most convincing among city leaders and why city leaders should invest in community health. So fiscal responsibility and prevention and quality of life. I'm not going to read through these. You're going to have the slides and you'll be able to read through these in more detail. But I think we've kind of talked about like return on investment and how that really resonates with policymakers, but understanding that this other message around quality of life can be really powerful as well. But it's really important to realize that one size does not fit all. Their research shows that fiscal responsibility, that message resonates with a different audience than the one for quality of life. So I just encourage you to go to the Big Cities Health Coalition messaging resources to see more detailed findings and information. Okay, I was so eager to get to the SACO and Beth, I'm going to turn it over to you to talk. Am I even saying that acronym right? SACO? Is that correct?
I'm gonna see what Ross says. I've always heard SoCo, but
Oh,
I've only
shoot.
probably ever heard him say it. So it's
So
probably
one
one of
could
those,
be the-
if you
you could do
invent
the
it, you get to
Canadian
decide.
version. Beth. You do the Canadian version. SOCO in the US.
Okay. Oh, that's funny. My Albertan accent coming out. Thanks, Renee. Well, so I know you haven't been sitting that long, but I am going to say that I have 2 little boys, and we talk a lot in my house about how bodies were made to move. So I can't see any of you guys. If you need to stand up and do jumping jacks, you have my full support. You might even help you listen. At least that's what I tell my little people. So the SOCO or SACO, basically what we're going to try to do now is talk a tiny bit more about the message and then focus in on the channel from our 75-year-old, still very effective communication model. So your SOCO, I got to stick with it, is your single overriding communication objective. What's the big picture, main thing that you want to communicate? And you think about one audience, one message, one issue. We're trying to be specific here. So if you put something in the chat earlier, kind of have that swirling around in your mind now for how you might draft a SOCO. So the change that you want to see in your target audience as a result of your communication. So we're trying to make sure that, again, what we do, what we communicate is actually having an impact, is doing something. So we want which audience to do what in order to what. And these are the pieces that you can fill in. We state it as an outcome. And you want to be explicit, like super clear and precise, realistic. And I'm sure you've seen somewhere some training along the way that helps you think about how to write good goals. You want them to be realistic. You want them to be time limited. This is not like, please give me your Christmas list, I say to my 7-year-old, but realistic, time limited, explicit. And then there's a, well, you know what, let me show you some examples, the fixed point for developing your message. So actually another thing I'll mention is sometimes your SOCO may be helping you raise awareness of an issue. It may just be that that's where you are in the scheme of communicating about your topic. If awareness is already increased, if people kind of know about the topic, maybe your goal is different with your SOCO. Maybe you're trying to frame a specific action that you want people to take. So let's look at some examples, because I'm somebody that learns from an example. So we'll start on the left. Lives will be saved if children and adults who have not been vaccinated get the measles vaccine now to prevent spread. So here's what you want people to do. Contact XYZ County Health Department for more information about free vaccine times and locations. So this is time dependent. It's clear. We know exactly what we want people to do. We want them to contact health. The health department, we want them to get vaccinated. Another one in the middle might be that worker productivity is decreasing due to extreme heat. So support Senate bill, and you can be very precise about it, to institute heat safety regulations to protect outdoor workers and improve productivity. And then the third one, and I know you have these, but I think just as you're trying to think about how to produce one yourself, hearing examples can help. The developing brain is highly vulnerable to the effects of nicotine. Support the Tobacco 21 bill to protect our young people and save lives. Another thing that you can think about when you're writing your SOCO is to use social math, which is probably something y'all, if you don't know the term, and I bet you do, you've definitely seen it. So you can break down numbers in a way that kind of makes sense for how people think. For example, you can use time. Like if you're talking about time, this is the equivalent of 50 kids in every class period doing XYZ. Or comparison with familiar things. Last year, school served 70 rail cars full of apples each lunch period. I hope that's it, not pizza slices or box cars full of French fries. And then you can also use like an ironic comparison. You could say we spend 10 times more money on pizza in a year than we spend on X. So finding a way to take numbers and put them in a context that kind of gets people's attention and helps them understand. So sort of like conceptualize a number that may not mean as much otherwise. So that's your SOCO, and you are welcome to adopt whichever pronunciation you prefer. So back to our model. Talking about the channel now. So this is the how. This is how we get the information from the source, the message to the audience. So if you take just a minute and in the chat, I think this may be the last time we're going to ask you to type for us. What are some of the most effective channels or methods for reaching policymakers? What things come to mind that you have used or that you could use or that you've seen? Maybe you've never used and you've just heard of, right? In-person meetings, asking for a meeting. Yeah, especially at the local level, if you can have a relationship and actually have an in-person meeting. Social media, my expertise. Yep, attending council meetings. Other ideas. Fact sheets, that's one. So we got a lot of in-person things. I like that that's some of the first stuff that you guys thought of. But yes, fact sheets, briefs, things like that. I think if you'll go on to the next one. Renee, thanks. Okay. So yeah, you've got written things, written formats. You can do a brief, you can do a report, we can use infographics, and you've seen those, and I'll show an example of a couple in a minute. You can email, you can put things on websites, of course, social media. I'm totally ill-equipped to talk about this one because I'm not on social media, but I bet all of you could tell me how well social media could. No, I understand how it's used. And I do think this is 2024. This is how a lot of people are communicating. So, then of course, traditional media, you've got newspapers, you've got television. And then I like, again, how much you all brought up face-to-face meetings, like in-person meetings, spending time in the office. As somebody said, legislative forum, so I was thinking of the opportunity to give testimony like you see here. It's easiest sometimes to just do one of these, but I think that the evidence shows that it's most effective if you can use multi-channel communication. So if we do more than one of these, maybe you create a fact sheet, maybe you have a face-to-face meeting, maybe you can get the fact sheet on social media, you can email it, you can get it in the media somehow. So try to think about ways to utilize multiple options here for your communication. Okay, so a policy brief. Let's just talk about this one particular format, one method of communication. An effective, so it's basically, you guys know, it's a policy engagement tool. It's a way to support your meetings. It's a way to pique the interest of stakeholders. It answers, ideally, some of these questions. Why do we need to do something different? What's the problem? You know, what isn't working? What should we do? So policymakers are interested in knowing, is there a policy solution to this problem that you're talking to me about? And how do we do it? So why does it matter? To whom does it matter? Is it going to work? And here's a big one. What is the cost? So policymakers don't have a lot of time. Nobody has time, I feel like, anymore to do reading, but policymakers especially are inundated with information to read. There's a study I remember that says that showed that policymakers read for detail like 25 or 27% of what they receive, and they never even get to 35% of it. So they're getting a lot of stuff to read. So how do we take what is our SOCO, what's the main important message that you want them to have, and be sure that they can receive it in a format they can digest and in a way that they can use? They want you to get to the bottom line quickly. They want you to talk about cost. So let's go to the next slide. yeah, talk about cost, talk about, and remember, actually, I should say, when you're thinking about cost, there's financial cost, and then also keep in mind what the political cost might be of some of the solutions that you offer. These elements that you see on the right-hand checklist, these are things that are part of a good policy brief, but they're like blueprints. It's not required that you have every one of these. Having a good catchy title, having a rationale for the action on the issue that you're talking about. Some of the possible things that you could recommend, and it's good to give a variety of choices. You know, what are some of the policy options that that you might ask them to consider? And then, because you want this to be brief, and short, and lots of white space so they can not be overwhelmed by the words, but you want them to have the opportunity to learn more if they have other questions, if they need extra information than what you provided. Be sure to include sources, references, like obviously cite what you include in the brief, but then have places where they can go to learn more if they really get jazzed about it and they want to learn more and need more information. And then, of course, your contact details, because they might process a little bit of what you say, but if they, if they latch onto it and they want to go beyond and reach back out to you, be sure they know how to do that. So when you actually create your policy brief text, there are a couple things that we know that work well. An attention-getting title, something that really draws them in. And kind of think about what you want to read and how things sit with you, when you receive information. Write for scanning. So meaning organize your information into pieces with headings, bullet points, numbered lists. The more white space you have, the less overwhelming something is for somebody to read. Use plain non-technical language. Be sure you define any terms that they might not know. Use local data. We touched on this earlier, but anytime you have the opportunity to include data from the local area of the legislator, the policymaker that you're talking to, that really helps them care more about it because it's directly affecting their constituents. If you can include cost and economic data, that is also something, as we showed you earlier, that they're really interested in. And if you can use a story, this can be really effective. So you can use a story to show like big differences between groups. This group has access to this group doesn't, and sort of here's a little narrative to show what life looks like for those two different groups. You can use story to show changes over time, how a particular individual has been affected by something. These are really effective ways to make use of narrative or story. And then you can see short, punchy sentences, things that you get, but I'm married to an English professor, so we don't have a lot of short, punchy sentences in our house. But there are moments when he's explaining things to me that I think, I need you to take 2/3 of the words out of that sentence and help me understand what the point is. So think about that when you're writing these. Be sure that you're not including long, obviously, you've got your narrative, and I just talked about the importance of story, but mostly you want your sentences to be shorter, getting to the point, concise, brief, etc. And then anytime you can use visual aids, images, graphs, so images, like just even pictures, that not only helps break up the text, but it, a picture can, you've heard it communicated, you can say so much with a picture. So if you don't have some kind of graphic, like a graph or a figure or something, images can help. But then we're going to talk just also briefly about infographics. So I think that's actually one more slide, and then we'll do that. So as you're thinking about what can support your message, what you want to communicate, think about what else you might need to provide your audience. What kind of evidence do they need? And you can be thinking about this now with the issue that you may have put in the chat. Whose endorsements do you need? Who do you need to show is behind this? And then let's talk about graphics a little bit. I think we have one last little clip for you. And this is, it's under 2 minutes long. So here we go.
Hey, it's Jalen, and you're watching episode 2 of Fast Frames. In this episode, we're discussing how to talk about data. Numbers can make all the difference in advocacy framing, but they can't stand alone. If we present a lot of data without cues for how to interpret it, we leave room for people to misinterpret it. If we highlight a disparity between two groups without explaining its cause, people can fall back on stereotypes or misconceptions to explain it for themselves. If we stack up statistics to emphasize the severity of a problem, we're more likely to spark overwhelm and action. But with effective framing, a compelling statistic can help people see an issue in a new light. Here are 3 tips for framing your data. Number 1, order matters. Before you present any data, give some context. One way to do this is to express a value like interdependence or human potential that you'd like people to have in mind when they hear your data. Number 2, less is more. When we reduce the amount of numbers we share, we increase people's ability to think them through. We also give ourselves room to offer some context and help people understand what it all means. Number 3, highlight structures, not struggles. Select data points that help people see the need to fix systems, not people. For example, illustrate disparities in healthcare access rather than disparities in health problems. When we show that a problem lies in a policy or system that humans designed, we imply that they can be redesigned to work better.
Thanks, Renee. Renee hunted that one down for us. So I especially will just say I appreciate the fact that he echoed that less is more. And that's especially true, I think, you know, when you're presenting numbers. People get, if you talk to people about their favorite subjects in school, it's less likely to be math. I just think people get overwhelmed by numbers and figuring out how to process them and what they mean. So, you know, being selective in what you choose. Definitely still include data, though. We do have evidence that they want the numbers. They just want them in context. What does it mean? Is it presented in a way that I can sort of digest and know what to do with? And then just we'll end here talking like super briefly about infographics and ways that you can utilize them. So here's one. You've seen lots of these before. Here's an example of one. Fewer adults are using tobacco, but there's still work to be done. So you can kind of see how they've got a main point, they've got a couple of smaller points, we've got a graphic to show each one, some data, but it's not overwhelming. Let's go on to the next one, Renee. This is one from a policy brief from Illinois that uses data to build a case for a sugar sweetened beverage tax. And they show how much money is accrued from the tax and what it can be used for with a projected drop in chronic disease. What do you guys think about this? I tricked you. I didn't mean to. I said that would be the last time we asked you to text us or message anything. But is there anything when you look at this that you could mention in the chat? What do you like about it? Is there something you think could be better? Is there something missing? It's definitely simple. Well, I'll wait. What's something that maybe that we've chatted about that isn't super clear in this, or that's maybe missing, or something that you think they did a really great job of? I'm going to assume that you're all standing up doing jumping jacks like I suggested. And I know Renee wants to move to the activity. So I'm going to tell you that the only thing I think that this is excellent and it speaks really clearly to the point. It'd be nice to have a clear, like if you were giving this to a legislator, what's the action that you want them to take? Is there something specific? What would you want them to do with this information? I think that's something that, oh, good. Thank you, Nicole. I think the arrows are confusing. What's causing what? So I will pass it off to Renee to lead you through your activity, our activity, and I'll say thanks.
Thanks, Beth. Okay, yes, hang on, you guys. I know we just went through a lot of content. This is your opportunity to practice, to apply some of those things that we've talked about. So I'm not gonna give you a ton of time. It's just 8 minutes, but it'll get your wheels turning. And so what I want you to do on your own, so you've already identified your focus area or issue from the beginning of the workshop. So you've kind of got that down, or maybe you want to like zero in on something else. That's fine. So focus on a specific issue. I want you to identify the value that you want to emphasize. And I want you to think about and then articulate, what would the world or your community look like if you won on your issue? Okay, and I have some examples. I'm going to talk through those. If you like are just eager and you're fast and you get through that, you certainly can get to the next 2 items, identifying your target audience and then what you want your target audience to do. But let's focus on value and vision. And I'm gonna give you some examples. So I have some examples that we crafted. So around healthy food access, transportation access, and even adequate wages and income. So when we have access to healthy food, no matter where we live, it means our community is vibrant and thriving. Children have a healthy start with the nutrients to develop a healthy brain, providing the foundation for good health over a lifetime. And we have a healthy, productive workforce. Another example, so the value being transportation access for all. When we have transportation access for all, think value is opportunity. It means we all get to work and school safely. People get to the care and services they need. We enjoy all our community's amenities. And then final example, when we have adequate wages and income, it means we all are able to get the basic necessities of life. We have less stress. We're not having to worry about paying the rent and utility bills, and also like if we're going to cover it all. So we feel better physically, mentally, and emotionally. And we're able to channel energy toward our families and community. So practice some of this really like plain language value around your area of focus and visioning. And you've got some time. We'll connect in 7 minutes.